I think we are at a crucial juncture in the drive towards the Sustainable Development Goals, and within that there is really a great opportunity to leverage the role of community health workers as part of a broader strategy to advance primary health care, particularly in contexts where progress has been slower. As part of my presentation, I gave some highlights of the extensive evidence that is now available supportive of the role of community health workers in the delivery of a range of primary healthcare services ranging from reproductive, maternal, newborn and child health, communicable diseases, non-communicable diseases, health promotion, community engagement, emergency preparedness and response to outbreak. Given this evidence, I think it's now time for governments and for their partners to revisit strategically the role and the position of community health workers in health systems. There are major opportunities that are not yet fully exploited to integrate and support community health workers in health systems. And what this concretely means is to ensure that at every critical juncture in the human resources planning, implementation and management cycle, adequate space, adequate attention and adequate resources are dedicated to this important cadre, including reflecting the role of these cadres at the level of the planning, in budgeting, in adequate selection criteria, education strategies, and then all the way down to management, remuneration, supervision, performance enhancement strategies, etc. And recognizing that there is now much more evidence than before, WHO has taken the decision to develop guidelines on health policy and system support for community health workers, so as to better guide member states on the basis of state-of-the-art evidence on how exactly to implement these strategies for the adequate integration and institutionalization of this cadre. I thought it was particularly interesting to have a debate around the financing for these cadres, because I didn't hear actually anybody disagreeing with the point of institutionalizing community health workers, but there is at the same time an acknowledgement and a recognition that community health workers are not necessarily a cheap solution. Everybody understands that these programs are as good as the amount of effort and resources that goes into them, and within this there is a clear and important push, but still accompanied by the debate, towards the issue of remuneration and incentivization for community health worker programs. I think I've heard some very interesting conversation and debates about how we can create fiscal space for expansion of community health workers and for adequate recognition and motivation of community health worker programs. The main direction of travel seems to be towards a greater recognition, a greater role, a greater financing for these cadres, and there were, I think, very important suggestions made in terms of additional opportunities for resource mobilization from both domestic and international resources. And in particular, I believe it's critical that we don't only see community health workers as an additional program that needs to be added if resources allow, but really part and parcel of the main strategy that the country has, the mainstream health workforce plan, and this should be reflected in decisions at the planning and budgeting stage. I think there are major opportunities to be leveraged in terms of seeking greater efficiency in how resources are used, and given that there is also evidence that community health workers do represent a good value for money in certain services and under certain circumstances, that there is indeed an opportunity for ensuring a greater impact on population health outcomes and better value for money for the citizens of the countries in which they operate.